So, sir, it's 3, 2, 1. We are live now, sir. Over.
Okay. Hello and good evening and welcome to today's patient-centric e-masterclass on BPH and prostate gland enlargement. And today our speaker is Dr. Hiralal Adhikari. Dr. Adhikari is a consultant urologist at Hayat Hospital and Guwahati. I welcome Dr. Hiralal in this patient-centric e-masterclass, and I'm handing this session to you, sir, for some introduction. And we'll have a question and answer session round for our patient after that. Thank you.
Thank you, Dr. Souvik. Hello, good evening, everybody present over here. I would like to thank Dr. Souvik and all the team members of technical team and all the officials of Lupin to give me such a wonderful opportunity to speak on this very, very common topic called benign prostatic hyperplasia. You know, as you know, this topic is most commonly covered everywhere, but still there is some lack of understanding among the general masses, and for which the lot of patients suffer from immense problem before they consult any doctor. So I would be very happy to discuss, share some few discussions regarding this very common illness. Dr. Souvik has rightly said, I'm myself Dr. Hiralal Adhikari. I'm a practicing urologist, and I am working as a consultant in Hayat Super Specialty Hospital, Guwahati. So up to you, Dr. Souvik.
Thank you, sir. Thank you for your kind introduction. Sir, पहला question है about this benign prostatic hyperplasia. Prostate क्या है, sir? What is prostate?
Okay, yeah, this is a very good question. First of all, prostate. This is a lot of there is a lot of misconception regarding the prostate, and there is a very lack of awareness among people regarding the presence of a prostate. Most of the people do not understand what is the prostate. Well, I would say prostate is a part of the male reproductive system, where it is located on the undersurface of the bladder, at the base of the bladder, and just in front of the rectum, and it surrounds the male urethra. Urethra means the pipe which brings urine from the bladder, the exterior. So this prostate is usually the size of the prostate is in the size of a walnut. It has been classically described as the size of a walnut. And the function of the prostate is it helps to produce the ejaculated semen in our. It helps in fertility, it helps in reproduction by producing semen, seminal fluid.
Okay. Thank you. So, so coming to the next question, sir, what are the common disease conditions of prostate?
In younger individuals, in younger males, the most common diagnosis is prostatitis. Prostatitis means the inflammation of the prostate, be it acute prostatitis, or it may be chronic prostatitis. And in those aged more than 40 to 45 years old, the most common diagnosis is benign prostatic enlargement. Also, in some patients, also prostate cancer is also much more commoner in the elderly age group.
Okay, thank you, sir. Thank you for make us understand this about the prostate, disease of prostate. Sir, the next question is, what is benign prostatic hyperplasia?
Benign prostatic hyperplasia is it's a non-cancerous enlargement, or we can say benign enlargement of the prostatic gland, which occurs after the age of 40 to 45 years in male. It starts enlargement, and it causes a lot of urological symptoms, which we consider called as lower urinary tract symptoms. So this is not cancerous. This is a benign disease process. So, but it's very, very common in the elderly age group. So it's a benign process, which is in the long term, which can affect your bladder as well as the kidney function as well.
Okay, thank you, sir. Thank you for make us understand this, what is benign prostatic hyperplasia. So the next question is, sir, what are the causes of benign prostatic hyperplasia?
Well, the causes is still not understood till now. There are a lot of studies going on. The main cause is still we cannot elucidate the cause of BPH, but it has been there are different suggestions. There are several theories regarding the prostatic enlargement. So as we all know, the prostate is a normal organ in a male. So the prostate, the most common cause of the prostatic enlargement is considered as the aging process. It's a normal part of the aging process, and also during advanced ages, there is some hormonal imbalances like testosterone to estrogen ratio. So different growth factors So suggestion is there, theories are there, but the most common is, we can say, normal aging process.
Okay, thank you. So normal aging process is the causes of the benign prostatic hyperplasia. That's nice to know, sir. So, the next question is, what are the symptoms associated with the benign prostatic hyperplasia of the patients?
The prostatic enlargement, first of all, prostatic enlargement compress upon the urethra. So the
Yes.
symptoms can be obstructive as well as the symptoms can be irritative. We classify it as lower urinary tract symptoms, which can be voiding and which can be storage. So basically, the patients usually are they come to the doctor whenever they are having irritative symptoms. But yes, we can say that patient have significant difficulty in passing urine, like they had to give some extra force, or we call it straining, or the urinary flow is too weak, it's very weak stream, or they have to give extra pressure from their abdomen to pass urine. But usually these patients, they think that these symptoms to be a normal part of their urinary system, but they usually come whenever they have urgency, frequency, and nocturia. Frequency means the patient has to repeatedly go to bathroom for urination. Nocturia, they have to repeatedly wake up at night for bathroom, and which may affect their sleep, and also they may feel tired. And sometimes patients complain of urgency. Urgency means it's a sudden compelling desire to void, which is difficult to defer. And also associated with the urgency episode, some patients do have urgency incontinence, means involuntary leakage of urine at the height of urgency episode. So these are all other common symptoms of prostatic enlargement. Also, some patients complain of erectile dysfunction, some sexual issues. These are a part and parcel of the symptomatic complex.
Okay, thank you, sir. So what are the most troublesome symptoms along with this about the BPH?
The most troublesome symptoms
Mm.
is, as I have already said, the
Mm.
irritative symptoms, like increased frequency, urgency, incontinence, and nocturia. Like if the patient has to repeatedly wake up after sleep to go to bathroom 10 times, 15 times in the night, so they usually get tired. Also, some patients may have BP issues, so they are affected by these symptoms. But before these symptoms, the patient may have endured significant length of time with all those obstructive symptoms, which they may think, or they may adjust to that symptoms. So usually patient comes to us with this irritative symptom like frequency, nocturia, and urgency incontinence. Because urgency incontinence, it's a symptom which will hamper their day-to-day life, because they cannot travel in a long distance, they cannot go to a public and social function, so they are almost socially handicapped by those symptoms. And thus the patient comes to us with all these symptoms. And also, as a doctor, we are worried. What we are most worried is that patient also sometimes come with acute urinary retention.
Yeah.
So after significant time, after the patient has suffered significantly with this obstructive symptoms, the bladder gradually weakens, and at one time the bladder completely fails. At that time, the patient may come with urinary retention, and in that point, may have to put a pipe or tube through the urethra into the bladder to empty it. That's called catheterization.
Okay. Yeah, thank you, sir. The next question is BPH is a sign of cancer?
No, BPH is not a
Yes.
sign of cancer. Completely, totally different things. BPH and prostate cancer are different things. Yes, BPH and prostate cancer both are common in the elderly age group. The symptomatology of both they coincide significantly. There are symptoms of both, but the two pathological processes are completely different. But as a doctor, whenever any patients with lower urinary tract symptoms comes to us, we definitely will examine the patient for prostate specific antigen, or we screen the patients for prostate cancer, as these both are very common in the elderly age group. So we always should think at the back of our mind that whether the patient is having prostate cancer or not. So we routinely screen the patients for prostate cancer. But be rest assured, prostate cancer is not BPH is not prostate cancer. These two are completely different. And a patient with BPH, benign prostatic enlargement, does not have any extra risk for prostate cancer.
Yeah, that's good to know, sir. It's a sigh of relief of the patients that they think sometimes like a BPH is a prostate cancer and it is not a cancer, but regular screening has to be done for the patient. Here they has to visit a doctor regularly. That's a good point you have told. Thank you, sir. So next question is BPH is a rare condition?
BPH is not a rare condition. It's a very, very common condition.
Right. Yes.
In generally, in the age of more than 50 years male, BPH is the most common diagnosis for lower urinary tract symptoms. You know, it's a very, very common. It's a very common condition. It's a very common disease which we encounter in our day-to-day practice. It's very common.
Yes, that's a very common. Most of the patient complaints about this one. Thank you, sir. Thank you for your wonderful reply. So, how the BPH is diagnosed, sir?
BPH is diagnosed, first of all, patient comes with symptoms, clinical symptoms. The patient will complain of different voiding symptoms or different storage symptoms. So initial is the history. First of all is the patient's history. What type of history patient is giving to us? Because there are concomitantly he may be having urinary tract infection, concomitantly he may be having some other urinary stone diseases, or also, as I have said earlier, where we have to think about prostate cancer even in elderly patients. So clinical history is very, very important. After the history, then we have to go for urine analysis, because urinary tract infection also as a lower urinary tract symptom. Any urinary stone diseases or any renal diseases may also manifest as urinary tract symptoms. So history, clinical examination. In clinical examination, we do a digital rectal examination. We insert our finger into the rectum and we palpate for the prostate gland just to see just to feel the consistency, size, what is the size, tentative size of the prostate, what is the consistency, so that is there any underlying nodularity or hardness. And then we have to image the prostate with ultrasonography or whatever, CT or whatever. We have to image the prostate to see the size. And also we have to measure the post-void residual urine volume. In those patients who are having symptoms because of prostate, they will have significant amount of urine after voiding. They will retain their urine inside the bladder even after voiding. So this estimation is important. Then these are the basic investigation, and also uroplomb. With this uroplomb, measure at what speed he is passing urine, or what is the average speed, what is the peak flow rate, what is the total amount of urine, what is the average duration of urine. So all these factors we examine by uroplometry. So these are the basic investigations to diagnose a benign prostatic enlargement causing LUTS, lower urinary tract symptoms.
Yeah, right, sir. The diagnosis and the examination is very important. Thank you. And sir, what are the treatments available for the BPH?
Well, the treatment of benign prostatic enlargement can be grossly categorized into three major headings. Like, first of all is watchful waiting. Then number two is medical management, and number three is surgical management. So in watchful waiting, in very small gland, like in if the patient is having very mild symptoms, first of all we have to categorize the patients according to their symptomatology. So there are different scoring systems, there are different symptom charts, like American Neurological Association Symptom Index, AUASI. So with this, we just categorize the patient as having mild symptoms, moderate symptoms, or severe symptoms. If the patient is having mild symptoms, then if the gland is not so much bigger, and if there is any other complicating factors, then we may give the patient the choice of watchful waiting. We can watch the patient over time. If there is gradual examination, if there is symptom aggravation or any complicating factor, then at that point we may intervene. So this is a watchful. This is also a good reasonable strategy for some patients, those who are not fit, those who are not willing for treatment, and those who are not willing for the treatment as well as treatment associated side effects. And second category, medical management. In those patients, those who are having significant symptoms or moderate to high symptoms, severe symptoms in the category, and also those patients, those who are having very poor flow rate or any other complicating factors, or big size prostate, then there we just start some medications. These medications help to increase the urinary flow and helps the bladder to better drain itself. And in the third category, surgical option, we have minimally invasive surgical options like transurethral resection of prostate. Also, we have laser enucleation of prostate, transurethral incision of prostate. These are the treatment options. Open prostatectomy we rarely do nowadays. Initially, it was before a few years it was done, but nowadays almost any size of prostate can be tackled by laser enucleation, which we do very nicely in our center.
Thank you, sir. Thank you for the treatment is very important, and the patients want to know what are the treatments available. Thank you for telling all these things. Thank you. So the next question is, what are the main concern of the urologist that can affect the treatment of the patient?
Yes, as a doctor, whenever we examine a patient with prostatomegaly or benign prostatic enlargement, there are certain factors in our mind, like what is the exact size of the prostate. You know, the size of the prostate does not always correlate with the symptoms the patient is having. But then, having said that, if the prostate is hugely enlarged, grossly enlarged, if the median lobe is projecting into the bladder, so there are some in the size of prostate also we consider a few things, like if the median lobe is projecting into the bladder, what is the status of the bladder? What is the, if there is PVR, if the post void residual urine volume is too much, and one of the most important thing, if there is upper tract deterioration, means if there is upper tract dilatation because of prostate, if the both kidneys are dilated, or there is worsening of renal function, then we usually do not watchfully wait the patient, or usually we do not put the patient on medical management. We straight away go for surgical management. So based on the symptoms, the severity, and also the complicating factors, like these are the in these conditions we usually go for surgical management. Like if the patient is having stones, if the patient is having worsening renal function, if the patient is having recurrent urinary tract infection, or if the patient is having acute urinary retention. These are the conditions where we usually straight away go for surgical management. And in other cases, if the patient is having mild symptoms, if there is no any complicating factor, we always start with medical management.
Thank you, sir. Thank you for answering this. Wonderful. And what are the next question is, what are the long-term complications of benign prostatic hyperplasia, sir?
See, the long-term complication, the long-term complication of benign prostatic hyperplasia, if left untreated, is there will be detrusor failure, you know, bladder failure. Post void residual urine will gradually. The bladder usually initially in the initial phase, the bladder tries to compensate by increasing the force of contraction. But over time, as there is increasing amount of post void residual, increasing volume, that will cause ultimately the detrusor to failure. So the patient will have a contractile bladder. That means his bladder, the patient's bladder will not be able to contract, and at the time he may end up having catheter throughout his life. Number one, and also the patients may have irreversible renal failure, kidney upper tract impairment because of the chronic obstruction. So these two are very much our concern. And also the quality of life, as we have already spoken, the quality of life is significantly altered, and the patient will have many other issues like sexual dysfunction, erectile dysfunction. So these are the long-term complications.
Oh, nice, sir. Nice. That is also very important to know about the complications. Okay. The next question is, can the side effect from BPH medication leads to a disturbed lifestyle?
I would say no, because this medical management which we are giving for the prostate is these drugs are very safe. There are no any other major impairment. There are no any other major adverse effect. There are a few minor adverse effects are there definitely, but that can be very easily handled. So these drugs are usually very safe drugs. There is no any other major adverse effect associated with all these drugs. So patients are tolerating this medical management very easily.
Okay, thank you, sir, for assuring us that it doesn't have any great side effect, these drugs. Thank you. Then the next question is, do only older person get BPH?
Not necessarily. The BPH, the incidence of BPH starts right from the age of 40 years.
Yeah.
As the patient ages, the percentage or chances of having BPH increases significantly. By the age of 90% of person will have BPH. So,
Okay.
patient may, after the age of 40, they will have a chance of BPH.
Right. Thank you, sir. Sir, there are also some additional questions from the audiences.
Okay.
In the chat box. The first thing is surgery. There is a myth like a surgery for BPH is complicated and has a short-term success. Can you just put some light on this?
I will be happy to put some light on this. Initially, when the surgery was developed for prostate BPH, transurethral resection of prostate, it itself now also it's the gold standard in the treatment of benign prostatic enlargement. But yes, and the medical management, surgical management has done a tremendous change over recent years. So transurethral resection of prostate do have some issue, like it has a slightly higher chances of recurrence, and also the operation is itself having higher chance of complications. But it's not true that all patients will recur after having undergone surgery. All patients will become incontinent. Well done transurethral resection is still helping the patient a lot. But nowadays, laser enucleation of prostate, after the advent of laser, there is significantly drastic reduction in all the complication rate and the recurrence rate associated with the earlier surgical treatment. So now I can rest assure my patient that no need to worry about all these surgery complications. There's less than 1% chance of stricture or incontinence or recurrence rate associated with the procedure, laser prostatectomy. So I would advise my patients to please come forward. If surgery is required, please do not hesitate for the fear of complications in the present scenario.
Yeah, thank you, sir, for killing this myth. Thank you very much. There is another question. Nowadays, prostatitis is most common in young age group and recurrence rate is much higher. So please guide us about the same.
You told prostatitis, right?
Yeah, prostatitis. Yeah.
This is very common, in the in younger age group, basically less than 40 years, very common. Overall prevalence of prostatitis is 7%. Do you imagine? Can you imagine 7% is too much?
Yeah. Yes.
Overall prevalence of prostatitis is 7%. So we get very young patients now and then, very often, like complaining of burning urination or some discomfort in the lower urinary tract. So prostatitis is very common. And the treatment part is also a bit difficult in young patients, because most of the patients are also having some psychological issues, anxiety issues. So overall, I can say prostatitis is very common in young patients. And yes, we can treat. There is a treatment is there with antibiotics if it is acute bacterial prostatitis. But then if it is chronic prostatitis, the treatment is a bit tricky. We have to localize the bacteria. If it is chronic bacterial prostatitis or chronic non-bacterial, there are specialist treatment. So overall, chronic acute prostatitis is very common. Acute or chronic prostatitis is very common in younger age group.
Yeah, thank you, sir. Thank you, sir, for your wonderful answer to our audience. The next question is, does BPH plays any role in erectile dysfunction patient?
Significantly. BPH, in patients with BPH, they usually have some erectile dysfunction associated with it. As we all know, because the nerves in the nerve supply of the penis is very closely to the prostate, So BPH, in patients with BPH, erectile dysfunction is a very common finding. So we have to add this issue as well.
Okay, thank you, sir. So I think so. There is no more question. So anything you want to tell our audience? Some tips about how to maintain the lifestyle and all this, sir?
Yeah. First of all, I just want to plead all the audience over there, those who are listening to the program. First of all, because the symptoms of BPH is associated with some sort of shyness among the patients, some hesitation to seek treatment, some hesitation to consult, to discuss openly with this problem. Leave your hesitation, because prostate can happen to anybody above the age of 45 to 50 years. So very, very common diagnosis a lot of patients are having. So just seek treatment whenever you have problems like increased frequency of urination, increased need to go to the bathroom. you have to apply some extra pressure, extra force or strength while urine, or you feel whenever you feel the speed of the urine is getting reduced, or the flow is very weak, stream is very weak. So and don't just leave all this myth that the prostatic treatment is very operation is associated with a lot of complications. Safe surgery with major surgery, and also it will improve your quality of life. So, and also erectile dysfunction. This issue can be easily addressed by any doctor. So consult a doctor whenever you are having this kind of symptoms.
Yeah.
My audience.
Yeah, thank you for your kind words, sir. There is another question popped up from the audience. They're very enthusiastic about this program, I think. What are the effects on prostate if the person is being involved in excess sexual activity?
No study has been proved like excess sexual activity has any effect on prostate, because excess sexual activity per se is a part of a normal human physiology, normal human physiology. So excess sexual activity has no effect on prostate. There are a lot of studies where they have failed to prove any correlation between excess sexual activity and the benign prostatic enlargement. Most of the time, there are some association is associated with obesity, family history, and also some genetic association is there, but there is no any direct link with any sexual activity.
Okay, so thank you, sir. There is no more questions. So I think so we are concluding the session. Already you have addressed our audience what to be done and what not to be done, and you killed most of the myths, and you have answered, means like you have make us understand about the BPH very much. And on behalf of Lupin, we thank you very much to our viewers, and especially to you also for this wonderful session and for the wonderful discussion. Thank you very much. Good night. Take care, sir. Good
Thank
night.
you, Dr. Souvik. Thank you very much.
Thank you, sir. Bye. Yeah.
Thank you, sir. So I'm ending this meeting now. Thank you.